I'm Dr. Sara Hanley at Bloomington-Normal Audiology, and welcome to I Hear You, where the audiologists at B&A answer your hearing-related questions. Tony in Normal asks, how do I know if I need a hearing aid in the first place? What are the warning signs? That is an excellent question, Tony. So, more often than not, hearing loss happens very gradually over time. Our brains kind of learn to adapt or compensate for the changes in our hearing, which makes it really difficult for us to tell if we're missing things or not hearing as well. In general, we have a few common situations that a lot of our patients start to notice that help them get an idea of if they're not hearing as well as they used to. So, first situation I would ask you to think about is if you're having some difficulty distinguishing dialogue on the television or over the phone. And on top of that, if you're also noticing that you're gradually turning the volume up louder and louder on either of those devices. Next, I would consider if you're asking for frequent repetition because you're feeling like speech isn't very clear or it sounds like people are mumbling. And then finally, I would take a look at how you're responding in groups or crowded, noisy situations. If you feel like you're really struggling to make out conversation in those environments and having to really put a lot of effort into that situation, then you might be having some form or degree of hearing loss. So those are some of the subjective ways you can kind of look at the situations you're in and how you're responding to them. And if you're somebody that prefers a more objective method, there are some different online hearing screeners that you could look at. I personally like a couple of the hearing aid manufacturer options. So Phonak and Starkey, they both offer online screeners where you can actually use your headphones, and they kind of try to guide you by putting the volume at around 50% for your headset, and then playing different frequencies at different volumes to give you an idea of where your hearing levels are. So whichever method you prefer, more subjective or objective, that's going to give you an idea if you are starting to have some decrease in your hearing. And if you find that there is some loss, you think there is, the next step would be getting into an audiologist where you can have your full diagnostic hearing test done, and we can determine the exact degree of your hearing loss and if any treatment is needed. Hope that helps. If you have more questions, let us know. I'm Dr. Sara Hanley at Bloomington-Normal Audiology, and we are here for you.